Hello, you're watching Health Day Now. In today's episode, we'll be joined by the former Chief of Staff at the CDC to discuss what the agency learned during the COVID-19 pandemic and how it plans to move forward. We'll also take a look at the long-term effects of COVID and how you can boost your vaccine's effectiveness even further.
COVID-19 patients face an increased risk of developing heart disease and diabetes, especially in the first 3 months after infection, a new study finds. Scientists reviewed the medical records of nearly 1 million people. Half had contracted the virus, while the others had not. The results showed those in the COVID group had 81% more diabetes diagnosis in the first 4 weeks after infection, and their risk was elevated by 27% for up to 12 weeks. COVID patients were also 6 times more likely to develop heart disease, mainly caused by blood clots in the lungs and irregular heartbeat. The risk of new heart disease started to decline at the 5-week mark and returned to normal within 12 weeks to 1 year. One author says, "It is clear that particular vigilance is required for at least the first 3 months after COVID-19. He and his co-authors say doctors should advise their patients to reduce their risk through a healthy diet and exercise." Many COVID-19 long haulers still have neurological symptoms such as headaches, fatigue, and memory problems 6 months after their initial infection, a new study finds. The study included 56 patients with mild to moderate COVID who completed a series of neurological and cognitive assessments. At the first assessment, 89% of the participants had fatigue and 80% had headaches. Other common symptoms included memory problems, insomnia, and trouble concentrating. Most said these symptoms affected their quality of life. At the 6-month follow-up, only 1/3 of the participants said they no longer had any neurological symptoms. The other 2/3 said their symptoms were less severe, but they were still experiencing memory impairment and reduced concentration. The senior author says some of these participants are high-level professionals who we'd expect to score above average on cognitive assessments, but months after having COVID-19, they're still scoring abnormally. She says the neurological symptoms in long haulers are likely the result of COVID-19 triggering an inflammatory autoimmune response in the brain. The researchers plan to continue monitoring the study participants' symptoms annually for up to 10 years.
Hello and welcome to Health Day Now. I'm Abel Jong. In April alone, the Centers for Disease Control and Prevention underwent a sweeping review and launched a new center to improve its handling of future infectious disease outbreaks. As the evaluation wraps up and the agency looks to the future, we're joined by Kyle McGowan, founding partner at Ascendant Strategic Partners and a former chief of staff at the CDC, and Dr. Natasha Bagdasarian, the chief medical executive for the state of Michigan, to discuss what was learned during the COVID-19 pandemic and how the agency should move forward. Welcome to you both. Great to see you.
Thank you so much for having us.
Thank you.
Kyle, let's start with you. You were appointed to the CDC by President Trump in 2018 as one of the youngest political appointees at the agency, and you served as a chief of staff for 2 years. Now, the CDC was put in place in 1946 for health emergencies like COVID, yet it is still failing to communicate effectively with the public. What did you observe during your tenure there as some of the agency's shortcomings?
Yeah, I think, well, first off, I just want to thank you for having me on today to talk about this extremely, very important issue. And as far as the kind of some of the shortcomings that I've seen, a lot of it deals around communications, right? And being able to openly talk about the ever-changing dynamics of this pandemic. And I think a lot of folks tend to forget that COVID-19 was a novel virus we've never seen before. And so what we knew and understood about the virus was changing, especially early on in the spring of 2020. But unfortunately, the CDC truly hasn't been able to communicate directly to reporters and the American people like they should since, honestly, February of 2020. But this is what it looks like when you run a public health response or any type of emergency response out of the White House. It takes a very complicated process and response, and makes it 10 times or 100 times more complicated than it needs to be. And every time that a guidance document is put out, or every time a request for an interview is requested, there are 10, 15 different people from HHS on up to the White House that has to confirm or sign off on those documents and guidance documents. And we're asking the CDC to be nimble and flexible and communicate faster, yet we put all of these burdens in their way of being able to do that. And then when they stumble sometimes, like everyone does, we point to it and say, see, they're horrible. That's just not true. It's not true at all. They have all of these barriers put in place, and they need to be able to communicate outside of those burdens and barriers. The last administration ran this response out of the White House, and the current administration is doing that as well. And that's just not the best way to run a response like this.
Okay. Dr. Bagdasarian, you were named the Chief Medical Executive for the state of Michigan in 2021 to provide overall medical guidance to state leadership and inform public health policy. Now, if public trust in the CDC is eroding because of the lack of communication, how does that affect adherence to public health guidelines, which are built on trust?
There is clearly a ripple effect. So when the public doesn't trust what the CDC is saying, that also affects the public trust that we have at the state level and that our local health departments have with their communities. And I'm also hearing from medical providers, from my colleagues who are practicing clinically, that it's affected their clinical relationships with patients. It becomes just a lack of public trust in healthcare recommendations. And I will say that one thing that has hurt us in terms of public trust is not being aligned in terms of messaging that's going out there. And I know that you just talked to Kyle about how difficult it is to getting some of those messaging pieces out quickly and in a timely, agile way. But the other part of that is the CDC, we have to remember, is not just communicating with health reporters and the public at large. They also need to be able to communicate with us at the state level and at the local health department level. And it becomes extremely challenging if, for example, we are not receiving prior notice, if the CDC is coming out with new guidance, new recommendations straight to the public without that step of looping in state and local partners. Because again, when our talking points are not aligned and when we're saying different things, that's what further erodes public trust.
Kyle, from what you saw while you were there at the CDC, is it structured to address what Dr. Bagdasarian has brought up? Does it have the systems in place to provide the healthcare providers and on the state levels what they need to do to guide people through the health crisis?
Absolutely, if allowed to. And see, that's the problem, is that I wholeheartely agree that they need to be talking directly with the American people, but also with folks in the states to make sure our messaging is aligned. But those calls with state health officials and governors and are controlled right now either by HHS or the White House. And this is what happens when we run responses like this out of the White House.
Dr. Bagdasarian, you've actually delayed some CDC recommendations because you had a lot of unanswered questions, and some of your information was actually coming from the press, not directly from the CDC?
There have been a few instances where that step of briefing state health departments hasn't happened before a press release has been issued, for example. And it's difficult. This is a difficult situation, and I don't want to point fingers. This is nearly impossible to please everyone in the type of environment that we're living in now. But it makes it difficult for us to update guidance if we are dealing with just the amount of information that's being released in a press release, for example. And then on the flip side of that, there have also been times where we've needed to move a little bit faster than what the CDC is putting out in terms of guidance. And that is difficult. We don't want to do that. We want to all be in alignment. But the CDC is dealing with 50 states with 50 unique circumstances and very different things happening on the ground. And so I think it makes it difficult to put out one set of recommendations that is always going to apply to everyone. And I think one of the things that we can do better on here as a country, and this is not just directed at the CDC, this is all of us, but it's communicating uncertainty. I think that if we have framework and structure that we can better use to communicate uncertainty to the public, then we can issue guidance within that framework with the notion that it is going to change, with the expectation that it's going to change. And so far, I think that hasn't been done. Things have been issued, guidance has been issued as this is the new guidance, when instead it should be, this is the guidance for where we are right now, but we expect things to change.
Now, Kyle, you left 2 years later after joining the CDC, after you witnessed the dismissal of science by the Trump White House, and you actually described it as the suffocation of the agency's voice. After seeing that play out, do you believe that it would be in the interest of the public for the CDC director to operate separately from the Secretary of Health and Human Services?
So I think having the CDC director be more independent, whether that's a separate agency, whether it's an appointment to a 7-year term, I think all of those are great ideas that we need to talk about. But flat out, it doesn't matter if they have that independence, if they don't have the tools in the toolbox to be able to go out and get the data that's necessary to make real-time decisions, and the flexible funding to be able to continue to give money to states such as Michigan to build the databases and the surveillance programs that they need. The CDC is only as good as the entities that provide the information to them. And I think it's important to understand that the CDC really owns no data of its own. It's dependent on states like Michigan and local governments to be able to provide them that information. Around 70% of every dollar that comes into the CDC goes right out the door to states and local governments for their public health needs. And that's extremely important. But what we can't do is continue to fund public health by these knee-jerk reactions of, oh, here's Ebola, throw some supplemental one-time funding at it, make the problem go away. Here's Zika, throw some supplemental funding, one-time funding at them, make it go away. We did it with COVID. And all of that one-time supplemental funding goes to build, hire people, build the data systems and the structure that we need from a public health standpoint to be better prepared. Well, then states and local governments become dependent on that because they need it. Well, but then it dries up because it's supplemental funding.
In terms of spending, we are seeing spending on a new forecasting center, which is supposed to operate very similar to a weather center. Now, Dr. Bagdasarian, what do you think of that? Is that going to be helpful to state leadership?
Very helpful. This is exactly what we're trying to do here at the state level, where we look at what is expected in the upcoming weeks and months, and then provide that information to the public so that we can advise on masking and other social mitigation measures at the local level. So that's very helpful. And that's the way that we have been trying to frame this, is that we now need to be preemptive, proactive, look ahead, and provide this type of information very much like a weather forecast. And then also provide instructions for how we want people to prepare. So now's the time to get ready. Make sure you've got over-the-counter tests at home. Make sure that if you are eligible for a booster, that you have a plan to get a booster. So we can start messaging when we know that there are surges expected. I think that what this pandemic has really shown us is what an underfunded and stretched public health system looks like when it's really experiencing a public health crisis. And that's what we saw. And as Kyle mentioned, we need to build back some of these systems. We need to build back our data systems. We very much during COVID created a patchwork. We just pulled data from wherever we could, put things together in a very patchwork sort of way to get what we needed just to make it through the pandemic. And now we need to start looking forward and looking at what is the future of public health? How is the CDC going to function with the next public health threat? How will those relationships with state health departments look? What will the relationships with local health departments look? What are the funding streams? How can we modernize these data systems and get ready for the next public health threat, which I can tell you is around the corner. We really have to be ready for the next event.
All right. Kyle McGowan, founding partner at Ascendant Strategic Partners and a former chief of staff at the CDC, and Dr. Natasha Bagdasarian, the chief medical executive for the state of Michigan. I'm Mabel Zhang. You've been watching Health Day Now.
The COVID-19 pandemic pushed many already stressed out teens to the brink, according to a new study. Doctors at Boston Children's Hospital looked at the number of kids admitted to the facility for mental health crises during the year prior to the pandemic and the first year of the global health crisis. The results showed the number of adolescent patients making suicide attempts jumped from 12 to 21% when COVID hit. Admissions for depression, anxiety, substance abuse or misuse, and OCD also rose significantly, as did the wait for a psychiatric placement. The authors say the isolation and fear caused by COVID-19 worsened an already growing mental health emergency among teens. They say this study highlights the vulnerability of a U.S. healthcare system that has been chronically inadequate at meeting the mental health needs of children and adolescents and raises an urgent call to reform pediatric mental health care. What is the best time for pregnant women to get their COVID-19 shots? A new study compared maternal and fetal antibody responses to several COVID vaccines, including Moderna and Pfizer, which use mRNA platforms, and Johnson & Johnson, which uses an adenovirus delivery system. Researchers measured antibody responses in 158 pregnant women and evaluated the transfer of protective antibodies via the placenta from mother to fetus. The results showed the mRNA vaccines produced more high-functioning antibodies against COVID variants such as Alpha, Beta, Delta, and Gamma, and demonstrated some neutralizing activity against Omicron. SARS-CoV-2 antibodies produced through the adenovirus system were found to be lower functioning. The researchers say first and third trimester vaccination boosted maternal immune responses, and the transfer of SARS-CoV-2 antibodies to the fetus was most efficient following first and second trimester vaccination. The senior author says these data support the initial vaccine series early in pregnancy if it has not yet been administered, with possible boosting later in pregnancy if eligible. The authors stress more research is needed to determine how to optimize maternal and neonatal immunity induced by vaccines during pregnancy. People who experience long COVID may be at increased risk for chronic lung disease, according to a new study. The researchers analyzed chest scans from 100 COVID-19 survivors who remained symptomatic more than 30 days after diagnosis and compared them to the scans of 106 healthy individuals. They found that long COVID patients were much more likely to experience air trapping, a condition that prevents people from emptying their lungs when they breathe out. Air trapping was seen in 25 to 35% of long COVID patients compared to just 7% of the healthy participants. The researchers say the condition occurred regardless of the initial severity of COVID infection and persisted for more than 200 days in some people. The senior author says it could be something related to inflammation that's reversible, or it may be something related to a scar that is irreversible. And then we need to look at ways to prevent further progression of the disease. The researchers plan to follow these study participants to see how many recover and how many continue to have breathing problems.
Thanks for watching Health Day Now.